everyone, welcome back to another episode of the Make Way for Youth podcast. In our podcast today, we're going to be discussing the Kenyan Reproductive Health Policy, and I have a guest, Lilian, who is an expert in these matters and will help us discuss this issue. As usual, my name is Orindi, and I am your host today. Lilian, over to you. Please introduce yourself.
Hi, everyone, and thanks, Orindi, for having me. My name is Lilian Muchoki. I am a sexual and reproductive health advocate, meaning that I am one of those people who are out there advocating for accessible, affordable, and good quality sexual and reproductive health services, and just to ensure that we are receiving the services that we choose, not because they're being imposed on us. So my background is basically that. I also have a bit of background in digital innovation for sexual and reproductive health. So having managed processes for the creation of various platforms that provide information and end user services like counseling and e-learning for just to facilitate access to accurate sexual and reproductive health information.
I'm curious, you've mentioned digital innovation products. So I've seen a couple. I've seen, I think it's Nana Binti on socials. Which ones can you talk to us about that maybe you'd advise young people to use?
I mean, if I was to speak about this, I mean, there are various digital health platforms, both locally and globally. I think locally, I would mention platforms such as what you said, Nena Binti. There is also it's a toll-free service. If you just Google Nena Binti, you find it, and then you find their WhatsApp number and their toll-free line. And then there's also Auntie Jane, which is also they also have a toll-free line, and they enable people who are looking for services to just to speak to someone, and then they're referred to the correct services. And then there are several chatbots, including I think there's one by Nivi. Oh my goodness, I can't remember. Oh yeah, Ask Nivi. It's called Ask Nivi. It's a chatbot that facilitates conversations just to access information. And then I think well, I can't remember all of them that are local, but globally, and some of the processes I worked on was there's a platform called safetochoose.org, which provides counseling services and referrals for sexual and reproductive health services. And then there was findmymethod.org, provides information on contraceptive. So there are several that have been created, and especially during the COVID period, we saw so many digital innovations emerging just to facilitate that access to information and services, and to ensure that the gap that was created, lack of personal access to information, there was no, because of the restrictions that came with COVID-19. So these innovations ensured that people and users, especially women and girls, are still able to receive information, and they could be referred to services. They could access things like telemedicine, from people like Mary Stopes and the rest that are in that field. So yeah, it's basically a lot of innovations that have spanned, and just to make sure that they complement what is already happening on the ground with the direct interactions with the service providers and community health workers and activists like me, and facilitators and trainers who are providing this information.
Thank you, Lilian. I've always found these digital innovations to bridge the gap in access to services. But anyway, so let's get into the reproductive health policy. So can you please explain to us what it is about, as if we are laymen, as if we don't know anything about it?
Sure. What is reproductive health policy? So, you know how in the world, everything that we do is guided by laws and rules and guidelines. So, even with the provision of reproductive health services in the context of Kenya, there is a document or a guideline that is usually developed, and it spans around a number of years, just to make sure that the healthcare providers and any other person who is involved in the process of providing services is aware of the legal provisions. So the reproductive health policy is basically a policy document that guides the provision of various services that span from family planning, issues to do with safe abortion according to the Constitution, and maternal mortality, issues to do with anything that is reproductive health, access to HIV care, access to antenatal care, everything that a person would look for, any service that anyone would look for based on their reproductive health is provided for by this document. So it just guides anyone who is wanting to access the service and who is providing the service to know what are the provisions and the limits, or legal provisions and limits in Kenya. So in the context of Kenya, when you talk about the reproductive health policy, then we are talking of the document that was provided that spans between 2022 and 2032. So the reproductive health policy of 2022 to 2032, meaning that for those 10 years, this will be the guiding document. And meaning that then, if we're talking about 2022 to 2032, there have been previous reproductive health policies, and so for the in the creation of the new one, the 2022-2032 one, it means that there was a review process which took into account the prevailing circumstances or development, just to come up with a new policy, or rather, ideally, that is what is supposed to happen, that we review the past document and then we look at the emerging issues, we look at the gaps, we look at the data. It's not just numbers to tell us the story of what is happening in reproductive health, and then to provide guidelines on how we want to move forward with all these issues. So I would say that is what we are calling the reproductive health currently. And it was launched in July 5th, 2022. And yeah, it's the operational document as we speak.
Thank you, Lilian. So I'm going to attach a link to the Reproductive Health Policy 2022-2032 in the description of the podcast for our listeners to have a look at it. So Lilian, so what are the contentious points or contentious limitations, for example, provisions in this particular reproductive health policy?
So, wow, this is the big one, because at the moment I just want to put it out there that we're in court, contesting the policy, and just asking for a review of some of the contentious issues. And basically, it started with the process. So the process of the review began back in 2017, but it wasn't until I think March 2022 that stakeholders, and especially those of us who are in the civil society, were invited to provide, our views on what we wanted in the document. But this was a very cosmetic process, if I can call it that, because the invitations were sent, but no document. The draft was not shared, and it was this secret document where we were just told, just come and we're going to review it together. And so, meaning that there was no way of preparing for for the document. And then something else is that even where the public participation process was held was in, I think, somewhere in Hurlingham or Kilimani. I don't remember the place, some hotel, which was actually not very accessible. So you can already tell that there were already barriers to participating in this process. But beyond that, you can imagine the document is being projected, and then now it's you're giving views, but you don't even know whether they've been accommodated, whether they've not been accommodated. And afterwards, you're asking to see the document, and it's not provided. But because there was a bit of resistance from our side, there was another public participation meeting where the stakeholders were invited to Mombasa, somewhere in Mombasa, to go for another public participation process in a very, I would say, in a quite expensive hotel. So this means that if you are a stakeholder in Nairobi or in any other part of the country, you needed to travel all the way to Mombasa and figure out accommodations and figure out how to get to the venue. Like you can already see, like if public participation is supposed to bring in everyone, then even like where you're holding the meetings, where how you're inviting people, is not supposed to be like something discreet. It's supposed to be open. And there are also complaints around lack of proper representations, especially you imagine that if you are making a document that is supposed to serve women and girls, then there's supposed to be representation in all diversities. So we're talking about women and girls with disability. We're talking about women and girls who are under 18. We're talking about just representation, like maybe from people who are, a bit older. So spanning across, because if I am, for example, between the ages of 20 and 30, and then someone else who's between the ages of 10 and 19, for example, the contraceptive needs are different. If I am a woman of reproductive age, my contraceptive needs are different. So there was no like proper representation. And that means then that the process of public participation was flawed. And it's actually one of the things that is being contested. Secondly, the document that was developed seemed to focus a lot on the issues around the need for consent, for especially for people who are under 18, so that they could access service, which we found to be quite, it was causing barriers, because already people under the age of 18 have a lot of hardships in accessing reproductive health services. So, and then now you're creating this other barrier where you're saying, if I have to go get tested for anything, if I have to go access certain services, I have to get consent. And forgetting that, one, most of the time when we young people are accessing these services, it is based on emergency. So it's not something that, like, for example, if you have like somebody who is not very open to providing that consent to you, they might delay care, and that might be problematic and cause further issues. They also forget that another thing is that this causing this barrier to young people was contradictory to other policy guidelines that had been developed. For example, there's what we call the adolescent package of care that has very clear provisions on how adolescents can access youth-friendly services. And it speaks about that consent can be given by either a parent or a guardian, but also recognizes that the young people have evolving capacities to be able to provide their own consent. And it also means that, for example, young people who are already parents, they are getting barriers. You're going for antenatal care, you need consent from your parents. Some of them are not even living with their parents. So what does this say, or what does that mean in terms of being able to access services? So basically, that was a big one, issues of consent. And then there was also insistent on abstinence, which I so the argument in the policy is that people under the age of 21 do not have cognitive ability to make decision about their reproductive health and their sexual health. And so sex debut should be deferred until the age of 21. So this is quite limiting, because it says that then, in terms of provision of services, the healthcare provider becomes confused, because now they're wondering, okay, this is what the policy says. Do we provide services to this person? Well, these people who the document is telling us do not have the capacity to make decision about their reproductive health? Or what are the legal implications for providing services that are not oriented towards, abstinence and, age of consent? So that was it was one of the big contentious issues, other than the issue around public participation. And another thing is that you'd think that the Ministry of Health would rely on data and their own previous guidelines to make decisions around new policies during the review process. But we find that with this policy, it seems more retrogressive compared to the previous policy. So it's like we are taking steps back instead of taking steps forward. And there seemed to be some diversion from relying on Kenya KDHS.
Just listen to the contentious parts of the bill, limiting access to reproductive health services to people under the age of, is it 18?
Yes, so that you'd require consent to be able to access this service. Yeah, but also telling you that you need to abstain up to if you've not reached the age of 21.
Yeah, so I already find that very, like, it's an ignorance of facts, because as you mentioned, from that Kenya demographical survey, the incidence of teenage pregnancy already is 15%. So this policy does not take into account the facts on the ground. But continue, please.
Yes, you're quite right. And I remember during that year, I think that's 2022, there was a research that was showing that 700 teenage girls were getting pregnant daily. So you can already imagine then what that means in terms of like the lived realities of women and girls in Kenya. Like, we are creating a policy that does not capture these realities, and so it ends up being discriminatory because you know, there's this element of how do you know that you deserve this service, or what does the healthcare provider think in terms of providing services? And you see that also affects planning and programming for healthcare facilities, because and even the different departments and at the counties level, because how do they program for something that they're already being told is not allowed? So yeah, that becomes quite contentious. You also want to imagine that um, provision of reproductive health service is not just a narrow thing that just contains issues maybe to do with family planning. It spans across so many services, that anyone can imagine. So using the people who created this policy, when they were using like what I would call their bias to create it, it meant that maybe they were looking to bar the access of certain services. And we know, like, even during the creation of the constitution, the issues to do with access to safe abortion was quite contentious. So I'm imagining maybe this is some of the things that they were looking at and thinking, no, 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 we need to bar this thing, but they're not thinking about, access to HIV care, things to do with STD treatment, antenatal care for teenagers and all that. So it's, when you look at it, then you start seeing like there's a bit of influence that is coming from I don't know where, and the government was not quite listening to the people who needed this care. And then there was also like I remember one of the other things that has been contentious was the policy tried to limit research, whereby it says that for anyone to research or innovate around sexual and reproductive health, you need to be given, I would say, consent or permission by the Director General. So then this means that, and if they vet you and they find you not enough or wanting, then they can say that this one is not, goes against public interest. But you see, again, if there's already bias being applied in the creation of the policy, what makes us sure that the same bias is not going to be applied during this vetting process? So some of these problematic clauses then means that this document seems to be diverting away from being people centered, and now it goes to cater for personal interest of people who carry their own religious and cultural biases that are not aligned to the lived realities of young women and girls in Kenya. Okay,
So,
sorry.
Lilian, you've already mentioned that you are in court fighting this contentious bill. One, what's the outcome that you're hoping to achieve? And two, what kind of support or call to actions do you have in addressing this specific issue?
Right. When I say we are in court, I mean that in solidarity of the petitioners, which I think it's proper to mention. There were some women, couple of women, Rachel Mwikali and Esther Aoko, who are young women, the key petitioners, and plus there are actually 4 key petitioners. Then there's an organization called Ambassador for Youth and Adolescent and Adolescent Reproductive Health Program. Then there is the KELIN. KELIN, it's Kenya Legal and Ethical Issues Network on HIV and AIDS. So they petitioned against the Cabinet Secretary for the Ministry of Health, just claiming that this reproductive health policy needs to be revised. So what then were they asking for? Basically, what they're asking for is one, they're asking that the court, which is the High Court in this case, stops the implementation of the policy as it is. Secondly, they're asking for the permanent order barring implementation of the provisions that hinder Kenyan rights. So you remember all those contentious issues that we mentioned, issues to do with with consent, issues to do with I forgot to mention the policy has actually quoted data that seems to favor married women and discriminate against any other demographic of women. So they're quoting statistics there and saying they're using them as referral point. But then the specific statistics that they took from the KDHS data are only leaning towards married women, and this looks like they're discriminating against women who are not married. So all these are clauses that are problematic and seem like are discriminative. So we are seeking an order to bar the implementation of these provisions. And then the big one is that, of course, we want the cabinet secretary in charge of Ministry of Health to jumpstart the process of reviewing this policy and make sure that there is meaningful public participation. Because again, as I mentioned previously, there wasn't meaningful public participation. And this is why we are getting, those biased opinions of God knows who. And yet there are all these young women. If you listen to like the adolescent girls, if you listen to women with disability, if you listen to any other young people, students in the university, if you listen to all these people, the language they're speaking is so different. Adolescents want to access contraceptives. They want to access, quality care without like having to go to their moms and dads to ask for help. And all of us have been adolescent at some point, and you know how we behaved and you know how we felt when it came to like, talking about sexual and reproductive health. What we were looking for and what they're looking for even now is youth-friendly services that cater to their needs in its diversity. So basically we are just then asking to go back to the drawing board and bring in all the necessary stakeholders and have them listened to. We do not want the same cosmetic public participation whereby people, yes, were given the opportunity to say what they wanted to say, but at the end of the day, the document that was brought for, that was launched did not integrate these opinions. Even after people went to Mombasa, I can tell you, people did not see the final draft until now when we heard that there was going to be a launch. And even this launch seemed like a very discreet affair. So the document is being launched and you're seeing it for the first time after it has been launched. And of course, people, stakeholders who felt not represented decided not to participate in the launch. But then later on, now when you're seeing the document and you're reading the document, you're realizing, oh my God, all the things that we said were not integrated into this document. So they just did a very it was like a talk shop where we just come, we talk, ongeeni mumalize, mkichoka mnyamaze, there's this thing people are saying nowadays in Kenya, semeni watoke, So it felt like a very semeni watoke process whereby no one is listening to you. You say whatever you want to say, but we really don't care. We're going to develop a document that we want. So we want to basically, ultimately, we want to go back to the drawing board and have a document that actually caters to the needs of Kenyan young women, boys and girls in their diversities. So, yeah.
Thank you so much, Lilian, for coming to this interview and to this podcast. It's been lovely to have you. I want to say that even I, as a young person, I didn't know that this whole review process was going on about this reproductive health policy. Yet I'm a SRHR advocate myself, but I was completely unaware about this. So I can imagine how many more people. Yeah, imagine how many more people who are not even in this space. They've never heard about this policy, but they don't even know whether this policy exists. So thank you for breaking down what the contentious issues are, and also for speaking to what your prayers are in the High Court. I do hope that you get the outcome that you want, and a better policy that has everyone in mind, that leaves no one behind, is brought to implementation in Kenya. So thank you everyone else for listening to this podcast. Remember, you can catch us on Spotify, iTunes, Apple Podcast, and YouTube. Remember to share, like, comment, rate this podcast.